Hi, I'm Dr. Kumar T. Vadavel. I am a board-certified periodontist. I want to talk to you today about how to treat dry mouth. Dry mouth can be caused by a variety of different things. This includes some diseases, including diabetes, not drinking enough water, drinking too many diuretics such as specialty coffees, tea, sugary sodas, smoking, medications, and more. Preventing dry mouth is important and necessary to the health of your gums and teeth. The bacterium that causes tooth decay multiplies in a dry mouth and produces acids that erode the enamel on your teeth. The same bacteria also cause gum disease. One thing that controls the bacteria is your saliva. When you have enough, it helps wash the bacteria off your teeth and keeps it under control. The bacteria produce acid from the sugars and carbs you eat. This is why you want to prevent dry mouth. It will definitely promote cavities, sensitive teeth, and gum disease. You can treat problems with dry mouth in several ways. Start by making sure you are drinking enough water. Sip on water through the day. Eliminate habits that are harmful to your teeth by stopping smoking, drinking alcohol, and reduce the sodas you drink. If medications give you dry mouth, see if your doctor can recommend a new prescription. When you have ongoing dry mouth, it is also important that you visit your dentist on a regular basis at least twice a year. This will enable your dentist to spot problems early in their development and will enable those problems to be treated before they become really expensive to correct.